Hi everyone, welcome once again to another episode on Health Talk with Fifi. With me, Ajwa, Juma, and Sak. And thank you so much for your support on this channel so far. Please, if today is your first time on this channel, kindly subscribe to our channel. Follow us on all social media platforms at Health Talk with Fifi for more content. And make sure you like, comment, and share this video. We'll be looking at pneumonia. Now let's get into pneumonia. Have you ever heard that when one sleeps on a cold bare floor, he or she can have pneumonia? Have you also heard that when there is too much air, when you sleep under fan, or when you are exposed to too much air, you get pneumonia? How true is that? Okay, so today we'll be looking at pneumonia and how true it is, if indeed it is caused by you being exposed to bare floor, or sleeping under fan, or being exposed to air for a very long time. Pneumonia is an infection and it affects the lungs. So it's an infection which causes the lungs to be inflamed. And it can be caused by bacteria, fungi, and viruses. Bacteria like Streptococcus pneumoniae, influenza virus, and respiratory syncytial virus. So these type of microorganisms can cause one to have pneumonia. When you have pneumonia, you can have coughing, or you'll be coughing, having fever, chest pains as well. You can also have difficulty in breathing. You can be fatigued, and sometimes even coughing up mucus substance. So the symptoms of pneumonia, they are coughing, fever, chest pain, difficulty in breathing, fatigue, and sometimes coughing up mucus substance. So these are the symptoms one will show when he or she is suffering from pneumonia. Now, what are the risk factors? Age. So in young children, they are mostly likely to have pneumonia. Why are young children mostly likely to have pneumonia? Young children, like from kindergarten to like primary school, are not able to take very good care of themselves. They are not able to do the regular hand washing or have a proper hygiene. So they are mostly at risk of having pneumonia because all these microorganisms, the bacteria, fungi, are being picked up or transferred from surfaces. So they picked up those bacteria or those microorganisms, maybe touch their nose, their eyes, or even their mouth, and they end up infecting themselves with the bacteria. So when the bacteria get into the body, they overgrow and they start to cause disease. So people at young age or young children are most likely to get pneumonia than adults. So mostly children are more vulnerable. They are more vulnerable than adults when it comes to pneumonia. Weakened immune system. When your immune system is weak, you also have risk of having pneumonia. Because when your immune system is weak, even if you introduce this bacteria into the body, your immune system should be able to fight this bacteria. So when it's not able to fight, then they cause disease. That is why most especially in children, they are able to. So when the bacteria or the virus or the microorganism gets in them, because of low immunity, they are not able to withstand. So it causes disease to them. So when your immune system is weak, you're also at risk of having pneumonia. Also, chronic lung diseases. When you already have a chronic lung disease like asthma, getting pneumonia is very easy. So when you have a chronic lung disease, you're also at risk of having pneumonia. Smoking. Those who smoke are also at risk of having pneumonia. Certain medication. So certain medication that you are on or you are taking can also put you at risk of having pneumonia. Now, let's look at some preventive measures of pneumonia. How can one prevent him or herself from having pneumonia infection or getting infected with pneumonia? So, pneumonia isn't caused by sleeping on a bare floor. So we've got to know that it is caused by microorganisms like Streptococcus pneumoniae, influenza virus, and syncytial respiratory virus. So these are some microorganisms that can cause one to have pneumonia. So it's not about sleeping on a bare floor or being exposed to too much air. So when someone sneezes, coughs, or even talk, and those droplets come. Sometimes when the droplets comes, they are being displayed on, or they are being spread on surfaces like tables, the chairs, and all those. So you can even use your hand to pick, and there are routes of entry: our eyes, our mouth, nose, and all those things. So that is why children are mostly at risk. They are not able to do proper hand or regular hand washing. So they end up having pneumonia a lot. So one of the preventive ways is to practice good hygiene. Since it's a respiratory disease, it can be transferred through air droplets. So when you are closer to the person, when you are closer to someone who has pneumonia or someone who is coughing more, you wouldn't know if it's pneumonia or anything. So you just have a distance, keep a distance from the person. 2 meters away from the person will be okay. And also practice good hygiene, like washing our hands regularly. Very, very, very important. You also have to avoid close contact with people who are sick, or especially people who have a respiratory disease. You wouldn't know the kind of respiratory disease he or she is having. So you just have to avoid contact. It doesn't mean you shouldn't take care of a sick person. But taking care of people with respiratory disease comes with its own preventive measures. If you have a mask, you can put it on. Keep your distance from the person. Regular disinfecting of the surfaces around the person, and regular hand washing of you and the person as well. So once you are taking care of a sick person or someone with a respiratory disease, these are some of the preventive measures you can take. Or you avoid close contact with people who are sick. You can also get pneumococcal and influenza vaccines to prevent yourself from getting pneumonia. And mostly children are supposed to get this one because they have lesser immunity, or their immune system isn't that strong enough to fight various infections. Thank you so much for staying with us on today's episode on pneumonia. I'll see you same time on next week Saturday. I know you've learned on pneumonia, and now you know that it's not caused by sleeping on a bare floor. There's no science behind sleeping on a bare floor and catching pneumonia. But sleeping on a bare floor, you wouldn't know if that floor is contaminated with Streptococcus pneumoniae. So that is why we are not advised to be on a bare floor, sleeping on a bare floor and exposing ourselves to too much air or sleeping under fan. So it's not that, but it's as a result of microorganisms causing you to have pneumonia. Thank you so much for staying with us. This has been Health Talk with Fifi. My name is Adjoa Duma, and so see you next Saturday on this same channel. Bye.